Hello and welcome everybody. Welcome to this webinar. I need to do a little bit of housekeeping before we get going. This is a recorded event today, and by participating in this live recorded training session, you're explicitly giving consent to be recorded for training and monitoring purposes, and that includes the sounds and the videos, and that we will share that on NHS training platforms and with users of those platforms. So should you wish at a later date to withdraw your consent and be removed from the shared recording, please contact us at learning.disability@hee.nhs.uk. And you can find out more about our privacy notice at www.hee.uk/about/privacy-notice. Next slide, please. So we would welcome your questions and ask you to post any questions in the chat box today. We will attempt to answer some of those questions in the session, and those we can't respond to online, we will send out a resources pack as follow-up. When you do ask questions, please make clear which part of the meeting content your comment or question refers to, because sometimes it can get a little bit lost and can be a little bit confusing. We will be sending resources out after the meeting, and again the same email address, learning.disability@hee.nhs.uk, to receive your copy. So let's get you started. I'll hand over now to Becky Chester, MBE, and Marie Lancet, who will introduce yourselves and get this afternoon session started.
Thank you very much, Tim, and welcome everybody. We're really excited to have you here to talk today about advanced practice and thinking about workforce development. I'm Becky Chester. I'm consultant nurse for people with a learning disability, and I'm working 1 day a week with Health Education England as clinical advisor for learning disability and autism. Marie?
Right. I'd like to talk to you about the development of the framework that started this piece of work. So if we could have the next slide, please. So the advanced practice framework was developed by a multidisciplinary team, and it represents various professions. But the definition of an advanced practice was that people with learning disabilities and autistic people experience a range of complex health and social care needs with multiple morbidities, and the framework supports the development of these highly skilled and effective workforce who through advanced practice level will be able to reduce the health and social inequalities that people experience. Next slide, please. So the framework was developed, as I say, and it was multidisciplinary, and we were ahead of the times really, because there was a drive for increasing the number of advanced practitioners, and a national programme for advanced practice was established. And this, the framework was developed alongside the core capabilities framework for people with learning disabilities and supporting autistic people, and it sat alongside the multi-professional framework for advanced clinical practice. So the framework was developed and launched by April 2020. Next slide, please. So having produced the framework document, we were very keen that we translated that and developed a curriculum which was a credential at an advanced practice level. And a credential is just a piece of learning. And in this case, the piece of learning is at master's level. So we went out to tender and we appointed Edge Hill and Cumbria universities to deliver that programme. We were very much wanted multi-professional applications. We want this to be absolutely person-centred, and it also forms part of the 4 pillars of advanced practice. So this is the clinical pillar, and I'm sure Deepak is going to say a lot more about that during his presentation. So the credential itself, which starts in September, is 50% clinical and 50% theory. There's an assessment of practice through the portfolio route, and we're also developing a community of practice to support people on that programme across the 2 universities. The programme has been co-developed and delivered with people who are experts by experience, and it's accessible across the 4 regions in England. It is available to the other regions, and Health Education England have funded 49 places on this programme. And although the credential can be delivered as a standalone postgraduate certificate, we are ensuring that people who go onto that programme complete the full master's programme, and we're asking for people to demonstrate the roles that they will be able to undertake having achieved the master's programme. So, next slide, please. Over to you, Becky.
Thank you very much. So, it's great that we've got 49 people that have been supported through Health Education England to undertake the credentials, and that offers us a great opportunity in terms of the development of our workforce. I'm really pleased to share that it's approximately, I think, 40% of the people undertaking the credentials are allied health professionals, and I think 60% are from a nursing background. So we've got a real opportunity here in terms of how we support our clinical workforce and how we support the development of meeting the healthcare needs and the complex healthcare needs of people with a learning disability and autistic people. So just wanted to really talk about what are the opportunities for advanced practice, and I would just ask that you think about this as you go through the rest of the presentations this afternoon, because what we need to do is not only think about actually how we undertake the education of our workforce, but we need to think about what are the opportunities from a workforce development perspective in implementing these roles, and what are the opportunities actually to have an impact in reducing health inequalities for people with a learning disability and autistic people. So one of the kind of greatest benefits is around the increased autonomy in complex clinical care and clinical decision making. By enhancing that clinical experience and clinical knowledge and that kind of working within kind of the complexity of healthcare, we've got a greater opportunity around complex decision making in order to improve health outcomes, and also about improving people's experiences of healthcare as well. I think we all probably are aware that across all of our services there can be service gaps, and actually by having advanced practitioners we're in a stronger position to be able to work across bridging those gaps across primary and secondary care, but also across the range of different services that people with learning disabilities and autistic people are accessing. And one of the benefits of advanced practice is around innovative solutions, quality improvement and evidence-based practice, and really looking at how we can implement those innovative solutions to improve people's experiences of accessing services and their health outcomes. We're also able to broaden the skills across our kind of traditional professional boundaries, and Natalie and Deepak will be talking to us a little bit later today and be able to really kind of explain how they've been able to work, I think, more with people with a range of complex needs, but actually how they've been able to kind of expand their roles and clinically to meet individuals' needs and work kind of across those professional boundaries. So we're improving really the experience and versatility of the professionals that we have within the teams. We've also got the opportunity through advanced practice to broaden not only the skills of our advanced practitioners, but actually to broaden the skills of the teams and the services that those advanced practitioners are working in and working across. So really that kind of ability to develop the workforce to meet people's needs. And that's being done through providing education, supervision and research. We know that a range of our professions are under quite a lot of pressure, and there is an opportunity to support people with more complex needs and to free up consultant time and GP time when working with people with the most complex needs. And advanced practitioners are really able to support with this. So it's about having the right skills in the right place And one of the great opportunities of advanced practice is around staff retention and being able to retain our most experienced clinical staff actually through clinical career pathways, so that we're not losing that knowledge and that expertise into kind of those operational roles, which often people do. If they want to kind of progress their careers, they're often having to go into operational roles. But we want to retain our expertise and our clinical expertise through advanced practice roles. Next slide, please. Lovely, thank you. So I just think, you know, these are just some headlines in terms of potential areas where advanced practitioners may be able to make a difference and impact upon how we deliver our services moving forwards. So actually, where could advanced practitioners kind of support in terms of some of those gaps? Can they increase the uptake and quality of annual health checks? Could we be looking at how advanced practitioners can work across services for people with a learning disability and autistic people and mental health services and start to bridge some of those gaps? Looking at assessment and support for autistic people, acute liaison. We know our acute liaison nurses and are working in very, very complex environments, coordinating very, very complex care. So how could we support those individuals in those roles through advanced practice to have a greater impact in meeting the needs of people with a learning disability? And we know that for some groups of people with a learning disability or autistic people can have kind of more complex needs. And actually that coordination role is absolutely paramount. So thinking about how perhaps we can use advanced practice roles to support with that complex coordination of care. And I just ask that you think about, currently we know from the LEADER programme the impact of respiratory health for people with a learning disability or coronary care. Actually, how could advanced practitioners impact in reducing those health inequalities that people are facing? Could we be having advanced practitioners who are supporting with respiratory clinics and thinking about just, you know, the difference that we could make, and how can we, I suppose, you know, reduce the current healthcare gaps that people with a learning disability have. So as we go through today's presentation, we just really ask that have a think about where your workforce gaps are and how could advanced practice meet these gaps, because we've got a great opportunity here to develop our workforce and to really be able to reduce the health inequalities that people with a learning disability and autistic people are facing. Thank you. Okay, so I'd just like to introduce you now to Natalie and Deepak.
Thank you. Thank you, Becky, for that. I am Deepak Agnihotri. I am an advanced clinical practitioner and a physiotherapist by background, and I am co-presenting this with Natalie. She's a speech and language therapist and advanced practitioner in Cheshire and Wirral Partnership NHS Foundation Trust. Today, we are going to talk about the role and the impact of advanced practice from a multidisciplinary perspective. Next slide, please. So as all of you are aware that advanced practice has 4 pillars: clinical, education, leadership, and research. So we have got a draft work plan, which includes, they say, 70% of clinical and the 30% includes the rest of the pillars. And recently, because the learning disability and autism credentials program has come in, and we have now got a skills for health framework, which shows the capabilities, which actually shows the each profession and the impact that we can bring as nurses, allied health professionals working as an advanced practitioner within learning disabilities and autism services. And this is what we are going to talk about. I will focus on clinical and leadership pillars, and Natalie will talk about the education and research. Next slide, please. So in CWP, Cheshire and Wirral Partnership Trust, we have been very fortunate that now we have got advanced practitioners from the background as physiotherapy, speech and language therapist, and one of our learning disability nurses, Adele Barber, is also an advanced practitioner. We all have completed and masters in advanced clinical practice. I have done non-medical prescribing as a part of the program, and it is a 2-year HE Health Education England funded program, and we have taken portfolio route as a dissertation. Now, one thing is which is unique in this is the unique professions. So as a speech and language therapist, as a physiotherapist, as a nurse, we bring something different to the table in actually providing the person-centered care for people with learning disabilities. We have now started nurse-led clinics and quality improvement projects in improving the dementia care, respiratory care, and other things that has a potential for this to improve on. Next slide, please. Slide, please. On a clinical basis, as Becky previously mentioned, what advanced practice course has actually given us is autonomous practice. We are now become an autonomous practitioner, extending the scope and using our advanced diagnostic and examination skills in managing the complex cases. And I have completed the independent prescribing course as a part of it, and we are using this in preventing hospital admission and facilitating discharge from hospital. During COVID, now the recent things has come up as long COVID. With my experience as a physiotherapist working in intensive care, rapid response previously, and complex care, I'm using all of those expertise within working as a learning disability physio in complex care, respiratory care, and rehab in managing those patients and meeting the physical health and the mental health needs of the patient. And one of the things which I'll talk about a little bit later is about the pain management and scope that working as an advanced practitioner can bring to the table. Natalie is now working, improving diagnosis of the neurodevelopmental disorders, and we are now working to prevent the diagnostic overshadowing, and we can use our skills to assess people and provide them the good quality of care by reducing the duplication and the system problems like accessing primary care or secondary care. Next slide, please. So just to give you a couple of examples, which I was mentioning about the physical health and mental health needs of the patients, an example I'll give you, one of our learning disability patients who had a history of depression and self-injurious behavior came for the team as a referral for a false risk and reduced mobility. I was able to use my non-medical prescribing skills and manage the pharmacological and non-pharmacological management and provide the service user and the mom were quite comfortable. We made a rapport. Instead of going into a different professions, I was able to manage that care, got the help from a psychology colleagues, a nursing colleagues, and able to manage that scenario and prevent a hospital admission. And now she's happy and well. And during COVID times, she has done really, really well. And another example is previously becoming an advanced practitioner. I was working as a learning disability physiotherapist. I didn't have much information about the medications or the mental health medications that has been used. When I went out to see a severely learning disability lady with severe challenging behaviors and problems with the behavior, nobody was able to identify. I went through the medicals and the examinations and the blood results, and I was able to pick up that this person is having lithium toxicity, when previously I would not have been able to pick that up. Now I am able to, and I can do the differential diagnoses and get that appropriate help and support for the person, liaising with the GPs and what we can do with the psychiatry of our team. And again, within working my limitations, but enhancing that, pushing those boundaries of the traditional roles that we have been working on. And now, because we are an advanced practitioners qualified one, we are able to refer people directly for investigations, for which previously we had to go through via GP, and which causes a delay in the system. And Natalie will talk a couple of case studies later on about from a speech and language perspective, how she has increased and used these skills as an advanced practitioner. Next slide, please. Leadership. Well, during COVID times and the leadership skills that I have gained by using the course and going on an advanced clinical practice course and doing the masters has improved. As an allied health professionals, it's a privilege. We are now pushing the boundaries and we are now showing what we can do. We are working now. We have got 4 work streams within learning disability care group, which is mental health, physical health, cognitive and neurodevelopmental. Each of us are leading and contributing the clinical pathways. I have done quality improvement project in embedding the dementia pathway within our service. and which has been significant. Natalie is leading on the neurodevelopmental pathway, and Adele is leading on the mental health pathway. And we are providing the clinical leadership, which is actually very crucial for a satisfaction point of view, for job satisfaction, as well as making that difference as well. Now, since we have done this, we have now got a greater links with the professional bodies, whether it's with the Association of Chartered Physiotherapists for Learning Disabilities or Royal College of Speech and Language Therapists. Another different domain I wanted to touch on is that during COVID, I am now recently taken a leadership role and become the chair of the BAME network of my trust, again, which is unique in itself. I'm now working with the NHS England in supporting BAME colleagues to have the risk assessments and the vaccination programs. And I'm working on a wider level to have a local, regional, and national impact in developing policies and strategies. So in using all the leadership skills gained, and it is wider than just a clinical domain. So it has been very, very impactful and effective. Next slide, please. Now, on a future point of view, I wanted to say that advanced clinical practice role has much more impact, as Becky was saying, that we can use the opportunistic consultation examination, use the leader as a review, bring up the physical health medications. And one of the examples I want to give here is reducing duplication, which is very, very crucial from my point of view. Was generally what happened was I saw 3 patients last week, and what happened was generally in previously, if they come with a challenging behavior, Down syndrome, or mental health problems, they have got PR and paracetamol. When you say they are in pain, you needed that more of a pain relief. Normally, they will go to the GP, then the GP makes an appointment and does that medication review and follow them up. What this does is creates a delay in the system and not able to get the appropriate care. I hope going forward, we'll be able to use the pain medications prescribing abilities to prescribe that and in a person-centered way and reduce that duplication and improve access to appropriate services. We are now, future-wise, we can look into end-of-life care, respiratory care, using those kind of things. I mentioned that we have done quality improvement project and implementation of dementia pathway. Another thing was we were able to reduce the dementia diagnosis from 24 weeks to 10 weeks from time of referral to a diagnosis, which shows how using this, enhancing the skills and supporting the colleagues, which has improved communication with the service users, carers, and the GPs as well. By doing this, we have received excellent service user and carer feedback as a part of it, and we have involved them throughout. Next slide, please. This example I'll give you is was an email from a carer. One of the examples I'll give you is a couple of years back, we had a Down syndrome lady with problems with significant behavior problems and pain problems and Down syndrome and dementia. Because the level of challenge we had system-wide, she had to be admitted to a service inpatient unit and has to be placed out of an area. Now, by using a complex care coordination, using the advanced skills, similar thing happened this January, where I was able to do the care coordination role, use the multidisciplinary approach and manage the pharmacological and non-pharmacological approach in that way. And the family were very pleased. We were able to prevent the placement breakdown, and now she is doing really, really well. And the family sent me this email to say, we feel that everyone is working together to improve the health and well-being of the person. We were working with the social care colleagues and the support staff as well, and working as a whole was very, very beneficial. We have got nurse-led clinics where people are finding it very, very useful and able to manage that well. So on and whole, I just wanted to say that this is just the start. We are working within our domains, but I think if we can use and show what allied health professionals bring to the table, a different set, we are not a mini psychiatrist or a GP mini one. We are pushing the boundaries and going beyond the traditional roles and showing that primary care, secondary care can work together. I think it will be different for each of you who will be going to go become advanced practitioner, what the service pressures are, what the things you would do, and you can make the role of your own. That's yeah, thank you. And I'll now hand over to Natalie. Next slide, please. Thank you.
Hi, good afternoon. I'm Natalie Hewitt, advanced practitioner and speech and language therapist by background. Thank you, Deepak. That was quite a seamless link into what I wanted to say next, which was traditionally speech and language therapists are taught at university this area of the anatomy. And I just wanted to give you 3 very quick case studies to demonstrate the extra learning that I've completed at university on the advanced practice course. So the first one was a referral for a gentleman who was 80 years old with Down syndrome. He's non-verbal, so he's not able to tell anybody what the problem was. He was referred because he was making choking noises while he was eating. So I visited as the speech and language therapist at the time. However, after assessment, there was no dysphagia observed. The gentleman's eating ability was absolutely fine. What I was able to do then, instead of having to send that patient back to the GP for further assessment, I was able to complete a full ENT inspection. I was able to palpate a cervical nose to look for any lumps or bumps which could be causing an issue. And I took a full clinical assessment and history around dyspepsia, which was my differential diagnosis for the choking noises that were made. I then referred directly to ENT because he had a very blocked ear, and we know the links between ear issues and elderly people with Down syndrome, which were previously overlooked. And following that, the plan was to refer him to gastroenterology to further investigate dyspepsia. A second one was a referral for a 45-year-old gentleman, again with Down syndrome. He was referred for panic attacks by the GP. When I went out to see him, and this is the beauty because we had time to spend with this service user, which is over and above often a clinic appointment at the GP, I was able to observe that this gentleman was very overweight. There was a history of diabetes, which wasn't mentioned in the referral. He had some mobility issues and there was some edema in his ankles. And when I asked his carers to demonstrate what he looked like when he was having these panic attacks, actually, it really seemed like that could be a possibility of angina or other cardiac issues. So I was able to refer that gentleman directly for an ECG. The final example, which is probably my classic being the lead for neurodevelopmental disorders, is a 19-year-old girl who was referred in by her social worker for severe challenging behaviour, which was, she was very at risk of being arrested, and because her challenging behaviour was very extreme. She was physically assaulting her school teachers and her parents. When I really looked into this lady's medical history and family history, there was a really strong history of hypothyroidism and neurodevelopmental disorders. Her brother has ADHD and her 2 cousins both have Asperger's syndrome. She's a lady who's 6'1" and 14 stones with microcephaly, and that she physically, to look at, there's strong suspicion that she might have a syndrome as well. So we've been able to refer her for bloods and for genetic testing also, which is something that in our service we don't regularly do. It is very costly, and we have to have a really good reason to do that. So those are the 3 cases that just show how much my clinical assessment has developed over the last 2 years. So if you go on to the next slide, please. I want to just mention briefly about training, which is a huge role for us advanced practitioners. Sorry, could you go back to the training slide? I shouldn't have said next slide. So training, we're involved in local training with our community learning disability teams, students and other clinical development posts. We have a reciprocal training arrangement with our other advanced practitioners in Cheshire Will Partnership Trust. So we are able to offer them training in our areas of knowledge, and we will ask the same from them. With Candid, which is our Centre of Excellence for Autism, Neurodevelopmental Disorders and Intellectual Disability, we have designed a training for paid and unpaid carers and families of people with intellectual disabilities and or autism. Also been involved in the conference which took place last month, which this year specifically looked at ADHD and other neurodevelopmental disorders, and that was a really fantastic opportunity. We also have some autism core training for psychiatrists, and as part of that I talk quite a lot about communicating and sensory difficulties of people with autism and help trainee psychiatrists improve their clinical practice and their assessment techniques for people with autism. Next slide, please. In terms of formal education, I know that Deepak has been asked to present and teach on the advanced practice training modules at University of Chester. So he's just graduated from there and they want him back, which is a huge, powerful statement. He's obviously made a really good impact there. Candid have developed a Master's of Science in Neurodevelopmental Disorders, and I've been asked to teach on that in the future. And we're also hoping to develop a PhD level programme. Next slide, please. Research is hugely important, and we know that it is quite often dominated by doctors and nurses. So we know as advanced practitioners we need to be able to move with the times. We need to be able to develop our clinical pathways with the latest advice. For example, in ADHD, we now know that the prevalence and comorbidity of ADHD and autism is much higher in intellectual disabilities than we thought it was. The Royal College of Psychiatrists has recently published that document, so we're now going to be ensuring that we screen everybody with either diagnosis that we see for the other one, so ADHD and autism. We're looking at validating a autism diagnostic aid. Now, I need to stress I'm not leading on this research, but I am taking part in organising locally participants that would be suitable for that research. Something that I am starting to lead on is research into avoidant and restrictive food intake disorder, or ARFID, because there is no published research with participants with intellectual disabilities, so that opens up a whole scope of opportunity for our service to form pathways there. There's a COVID-19 impact study which I'm involved with, and we take part in various quality improvement projects. And I know Deepak's been very involved in postural care clinics and audits of mental health medication alongside the Royal College of Psychiatrists. Next slide, please. So this role is really new, we all know that, and I think for Deepak and I and Adele, who's the advanced practice nurse, we know that this role is going to be ever changing and it's going to have to move and adapt with the times, whether it's our populations, the caseloads and the workforce. But it's a really exciting time for us to continue to develop our knowledge because there's so much more that we could possibly learn. We're hoping that the national understanding of advanced practice improves over the time. We are starting to build our credibility, but obviously in years to come the role will be much more well known. Speech and language therapists aren't able to prescribe at the moment, which is a shame. And if I'm honest, I would have liked to be able to prescribe in ADHD medication. However, that is being worked on soon, and the Royal College of Speech and Language Therapists are starting to look into this. We're hoping that eventually there'll be a clear developmental pathway to progress from advanced practice into a consultant to consultant roles. It's possibly a little bit less clear with allied health professionals, but this is all sort of work in progress, and we know it's coming, which is fantastic. And as Rebecca mentioned earlier, the beauty of advanced practice is that we now have more opportunity for progression. Just before I interviewed for the post for advanced practice, I was starting to apply for managerial roles. So, and then the opportunity came up, which was just brilliant. It was a really good opportunity at the time. So thank you very much. I hope you enjoyed it, and I'll hand you back. Thank you.
Okay, thank you very much, Natalie and Deepak. We're just going to hand you over now to Chris Hutchinson. Thank you, Chris.
Hi. So I've been asked to cover the approach that we've taken in Lancashire and South Cumbria to try and create these posts. But I think what you'll see from what I'm going to cover is it's not just about identifying a post that can become an advanced clinical practitioner. There's a whole range of other things that need to be looked at. So if I move to the next slide, please. I find this particular structure really helpful. I don't know if any of you have come across the Workforce Development Star from Health Education England. When you get into this, if you get onto the website and have a look at it, each element of the star is an interactive element. So you can click on something such as leadership, and that will take you to, can you just go back one slide, please, Ina? It'll take you to various resources linked to leadership and various other things. You'll see there is a part of the star that is specific to mental health and learning disability, and that includes a range of resources, again, that Health Education England have been developing, including resources linked to advanced clinical practice. So those outer points of the star are really useful in terms of thinking about the elements that you need to look at in a service when you're looking to develop new roles, new posts, and create new pathways, career pathways for people. So if we can move on to the next slide, Zena. Thank you. So in terms of leadership, within our organisation, there was a recognition that we needed strong leadership at all levels to generate change. In our organisation, we were in a position where there'd been a new executive board appointed. They were looking at transformation of the trust as a whole, and it was a really good opportunity to start at the top and work their way through. So our chief executive has particular interest in learning disability and autism. We have a specifically named executive director for learning disability and autism, and then they established consultant and associate director posts across all of the professional groups. So in terms of nursing, allied health professionals, psychology and psychiatry, as well as associate director level leadership for operations of learning disability and autism services as well, which was a bit new for the organisation. They'd usually had mixed portfolios. So it's really important to have that real clarity. I'm really sorry, I think there's some kind of, what's it called, animation on the slides that's presenting Zena with a bit of a challenge, needing to keep coming back. So I do apologise for the flicking slides there. So establishing that clear specialty and service line leadership is critical, because when you put in new posts like advanced clinical practitioners, if there isn't the leadership support around them, individuals can flounder, they can struggle. It may be that other parts of the system are too difficult to generate change and to accept new ways of working, etc. So that's really, really important. And we need to recognise this is about developing the future leaders. You know, it's about making sure that each professional group we have within learning disability and within autism services has that structure that allows people, as Natalie suggested, stay in clinical practice, to stay doing what they do best and kind of progress up through into more senior roles. So thinking about the career paths then, please, Ian, on to the next slide. We set out understanding the various different levels. This ladder is no different to most places. So, you know, starting at that kind of support worker level, working our way up to the chief of the profession. So the chief nurse, the chief allied health professional, the chief psychologist, the chief medical officer, which is what the exec posts are now called. Zena, it seems to be just running ahead with itself, I'm sorry. So, you know, thinking about the various things, we needed to make sure we didn't lose some of the senior professional posts. There's a risk of just selecting band 7 posts and switching them into advanced clinical practitioners. So being able to still retain some of those senior professional posts as well, so that people have something to work through, was really important. We did look at extended roles around some of the things Deepak's mentioned: nurse prescribing, prescribing for anybody who's doing the advanced clinical practice training, psychological therapy, sensory integration, and we're looking at other areas as well. And you can see where we've added in new roles there. So we've got new local directors of nursing associate directors of nursing, and the same for the other professions as well, down into the consultant and the advanced clinical practitioners. You can see also that we're evolving other roles, because again, you've got to have everything in the structure looked at. So you can chunk off a little bit, but you need to look at how you adjust some other elements to make sure that things sit together and kind of progress together. So moving on, Zena, to the next one. We've used the credential to be able to identify individuals to train who are either already practicing at an advanced level and need that further education and training to give the additional skills that both Deepak and Natalie have talked about. And we've also identified individuals in terms of succession planning. So we've used a combination of funding for the traditional route on advanced clinical practice masters for 5 nursing posts. And we've looked at an alternate route to advanced clinical practice for 4 others moving through the credential and then moving on to the MSc at a later date. But it's all about being able to share that vision to make sure we're attracting the right people. We're looking to retain clinicians in clinical practice, as I've said, and developing them and sharing what they're able to do, how they're shaping services. I mean, it's great to hear Natalie and Deepak talking about how it's made their contacts different and what the benefit is for the person receiving that support and that service. So moving on to the next slide. Thinking about the kind of upskilling and new roles, it's been built around other work that we've done. So we had support from Health Education England for a RAPT project, looking at population need, population profile, and what skills did we need in the workforce. So using some of that information to inform what we're doing, and combined that with upskilling people for new roles and new ways of working. As I've said, you know, we've got a separate stream that's looking at increasing the numbers of prescribers that we've got within the service. We're also looking at approved clinician development for individuals who are already at consultant level, and looking at other elements. So we're busy putting MPET funding bids together around some of the other issues, such as sensory integration and talking mats and postural care and things like that. So the training needs analysis is another piece of work we're doing at the minute, really getting into the nub of who's done what, and are we actually using that knowledge and skill to best effect, and what more can we add to their portfolio of knowledge and skill to kind of build them through into that career pathway. So final learning points on the next slide, please, Zena. Final learning points are just thinking about the total professional career pathway. Don't just think about advanced clinical practice in isolation. Look at where it fits. Think about how the role fits within your organisation and what benefits and challenges that might bring. Some individuals might feel that it's stepping on the toes of the role that they provide. Others might see it as a benefit to be able to release some of their capacity to focus on other things. But those conversations need to be had at a local level. Ensure there's a real champion for these posts. They're not easy posts to establish. It's difficult for people going through the training. It's not easy training. They will be challenged. They'll be challenged in finding placements, finding appropriate assessors, a whole range of things. So they need people to really support and champion what it is that they're being asked to do in training as advanced clinical practitioners. And ensure everybody understands that vision and commitment and can understand how things might shape and change and what contribution they'll be providing as well into the infrastructure and where they might fit in, where might it fit into their career. So talking to the new registered staff that are coming through training, the people who are doing nurse associate, assistant practitioner, all those sorts of training as well, so that they can start to be enthused and see that there is other things that they can do as they progress through it as well. So that's a whistle-stop tour of our experience so far. We're still very early on in our journey. Our advanced clinical practitioners are on the traditional route, have only just started the MSc course, and we've got people going on the credential in September. So we'll see changes over the next coming years, but we're more than open to receiving contact as other colleagues are, and questions as I hand back to our Health Education England colleagues. Thank you.
Thank you very much, Chris. That's fantastic. And we've got a range, a really good actual range of questions that have come in as well from people that are on the webinar. So I'm going to try and manage those as best I can. Apologies if we don't get to everybody's questions in the time that we have. If we don't manage to, what we will do is we will provide a response in the information that we share with you after the event. So we'll make sure that we do answer all of the questions if we don't get through them all today. So I'm just going to initially come over to Deepak, if that's okay. Deepak, there's a question asking about how did you go about forming the pathway, and in particular, as a physio, how did you use your prescribing skills and as an advanced practitioning physio, but also how were you able to influence and develop your role in prescribing? I think some of the services and areas have had some difficulties around this, so would like to hear your thoughts and ideas.
Yeah, thank you. I'm glad that question came because this is not a straightforward journey. I'll start by saying I have uncovered so much policy and system-wide changes that needs to happen. And I'll start by saying when I've done my non-medical prescribing, the form didn't had an HCPC registration on it. So it had only, NMC registration. And I'm like, okay, so now they have got a physiotherapist who needs to register as non-medical prescriber. What do we do with that? So just to tell you the level where we had to start, and I completely agree with that. I had to negotiate my way through. And as I said, we are looking from a challenging point of view of physical health medications, mental health medications, what is expected of us, how I have developed that, influenced that. What I can say this is I started with a negotiation. So where we can actually, we have been doing all the dementia assessments all together, and legally, if you say physiotherapist, by training, we are in a fortunate position. I did V300 non-medical prescribing, and I can prescribe anything from the BNF. But that's not true. The point is, I had to start with a very small P-formulary, which says of 5 medications to start with. And I negotiated my way through with the clinical director, with my clinical mentor was my psychiatrist who supported me brilliantly throughout my journey. And we didn't had a GP. So the medication I had to choose was I cannot just go for an antibiotic. So we negotiated and we got to the point that I'll start with the dementia medications as a prescribing. And I now have got little antidepressants and dementia medications and diazepam to start with. But my hope is I'll be able to extend that to pain management, respiratory management, and work on to the end of life care. But actually, that is a different world altogether. It's a primary care working with secondary care and the system barriers. So I think it's a challenging in itself, but as a physiotherapist, it's a lot of opportunities and we bring something different to advanced clinical practice as a physio. And I'm very excited with the opportunities lie ahead. I do hope this answers the question.
Thank you very much, Deepak.
Thank you.
There's also been a couple of questions in terms of who is able to access the advanced practice credentials. So I thought it might be helpful if I just gave a brief answer. So in terms of the 49 HEE funded places, they have been allocated to professionals that are registered professionals with HCPC or the NMC. But there is a real recognition as part of the Learning Disability and Autism Advanced Practice development and work and the credentials, that there's a range of other professionals actually that would really benefit as well from undertaking the credentials. So that is, I suppose, a work in progress. We're very much aware actually we've got behaviour specialists who may actually benefit from these credentials as well. So that we are still looking at the opportunities for other professionals as well. I'm going to bring the next question over, and I think this is actually for Natalie and Deepak again. Do you have any reflections of MDT working, and if we are bypassing the GP in some cases?
I can take that. One of the things that Deepak and I regularly talk about is often when we see a patient for an initial assessment, we almost arrive as more that we arrive as more than one clinician, and we can often take the role of a variety of the clinicians in that initial assessment. So MDT working is absolutely crucial, and we rely on our colleagues for all sorts of clinical insight and expertise, and we're not there to replace the multidisciplinary team, but we can take elements from each of the clinicians and apply that ourselves in a single meeting with patients. And when we talk about bypassing the GP, I suppose that's not strictly what we're referring to. We will always keep the GP involved in our assessments, but where we can request direct interventions, we think it saves time. We'll keep the GP involved. Sometimes we will phone the GP and just ask if they've got any concerns with what we're doing. And I think it's still a work in progress. The credibility of our role is developing still. Some GPs are fantastic and they'll say, you're the advanced practitioner, you can do that. And others will be really dubious, especially if they know of a speech and language therapy background too. Does that answer the question?
That's great. Thank you very much, Natalie. Did anybody want to add anything? Deepak?
I can add, and again, Natalie has made a point. We are not replacing anyone, and we are not a replacement, because that is a lot of time question comes is, are we going to replace the primary care or a GP? I'm going to take out too much responsibility on. That's not the point. The point is reducing duplication, providing more person-centered care and the access to the persons. Because if I gave an example of pain, I'll give you another example. When I have gone out and seen, and I'm not saying that GPs are not, they're brilliant at what they do, but generally if I have gone out and assessed the person, somebody's in distress using Distat or ACC, or I have seen somebody from a sepsis point of view, I think when you are looking for crucial time commitment problems, I think getting that timely intervention is crucial. Using our skills when we are involved, that person can have a major impact on the intervention. I give you an example. During COVID time, we had a service user, a boy with a gentleman with a profound learning disability and postural needs, severe problem. When I looked onto this, we did a consultation. First was virtual, and I could pick up there is something wrong with the hip. Now, we would not uncover that. I found out that they had a nut which was loose in that was causing that infection. This is not normal. That person went into an urgent surgery next day. And that is timely intervention by using the advanced skills. Now, we can go to the GP, go to the referral to the spine surgeon, to the hip surgeon, but that's the example of it. And we are not a replacement of a GP, psychiatrist, or any other member of our multidisciplinary team. We are actually enhancing the care for the person here. That's what I'm looking for. Thanks.
Thank you very much, Deepak and Natalie. Chris, I wondered whether you may be able to give some thoughts on the next question. So just thinking about, obviously you've got advanced practitioners currently undertaking their training, and we just wondered, one of the questions is about who provides the clinical supervision and oversight around the development of advanced practitioners. Thank you.
Super. So it is an interesting one, and it's one that varies from university to university. So one of the things that you clearly need to understand is which university are you linking with, what are their requirements, and what does that mean for what you need to generate within practice. So in addition to the individuals we've got within the learning disability structures, we've also got an advanced clinical practitioner development within our autism services, which are very small and developing, and they're with a completely different university that has completely different requirements around which modules are core and optional, and therefore what that means for the skills of the assessor or the supervisor. There's also slightly different terminology used across different courses as well, so it's important to understand that. So in terms of the individuals we've got going through the credential, we've got senior nurses within the learning disability service supporting those individuals, and we're also linking with consultant AHP colleagues in other parts of the trust for the professional element. The credential is a lot more tailored to learn disability practice and autism practice. So obviously being you know, somebody already functioning at an advanced level in those services is critical and key. However, for those who are undertaking the MSc, the university that we're currently working with for that requires that only an advanced clinical practitioner can assess the students in relation to their skills, particularly in physical health examinations, etc. So we've had to be creative. We've got an interim arrangement at the minute while we're looking to secure an advanced clinical practitioner with the relevant skills, training and expertise to be able to sign off their competencies. So we've got a tripartite arrangement with the university at the minute that combines consultant level practitioners with somebody from the university who's an ACP. Until we can get that organised, but it is something you need to think about ahead of time. We've been a little bit on the back foot with that one, if I'm honest. I wish we'd have asked an awful lot more further upstream. So please learn from us.
Thank you very much, Chris. I'm very much aware that we're just coming to the end of the time that we've got today, so I'm just going to hand back over to Tim, who will close for us. Thank you very much.
You're on mute, Tim.
It works so much better when I do that, doesn't it, when I take it off. Thank you so much, everybody, for joining us today. It's fabulous that you've been able to be here. Just to reiterate, any of the questions that you've posted that we haven't answered in the session, we will get out to you in a Q&A afterwards. The webinar will be available to watch in due course. And again, to access those resources, please email your details to learning.disability@he.nhs.uk. Thank you so much to all our presenters. You've been absolutely wonderful, and yeah, you treated us all to a wealth of your expertise. So thank you very much.